to have you join us, Dr. Ada Ikeako.
Thank you.
Now, when you put these figures side by side, and when you look at the numbers we're testing in Nigeria and the ones people being tested in Ghana, South Africa, if this low level of testing continues in Nigeria, what danger does it portend on Nigerians?
First of all, I want to congratulate the government on increasing the testing capacity in Nigeria. We had 2 labs at the beginning, at the onset of this, and now we have 9 labs that are capable of testing for the coronavirus. The thing is, we need to have our policy to be driven by data, and the way to get data is through testing. I mean, most of the Western countries and even some of the Eastern countries are estimating that you need about 750,000 to 1 million tests a week to be able to determine policy, to be able to say, okay, it's time for people to start coming out of their homes and no longer have to be socially distanced. So we need the data and we need a breakdown. I think we're doing really well. I like some aspects of our breakdown, like you talked about the states that are affected, the number per state. But we also need to know how many of these people being tested are carriers with no symptoms. We have to have that data, and we need, other parameters, in the data need to be explored as well.
Countries like South Africa have now adopted the house-to-house testing method. And we also see the U.S. talking about the rapid test as well. What can we do in this regard to ensure that we're doing rapid tests in the country?
First of all, we need enough testing kits. Jack Ma donated 20,000, but we've already had about only 5,000 tested. So we need a lot more kits. And there's an international shortage of these kits, so we're going to need to source for kits, for more kits, and test a lot more people in order to be able to make policy as to when to stop social distancing. What we don't want is another wave, another spread through asymptomatic carrier states, because we're not testing for people who don't have any symptoms of the disease whatsoever, but yet they're shedding the virus and transmitting the virus to other people.
Dr. Ada Ikeako, thanks for talking to us.